Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon. Thank you for all to all of our head of module, the postgraduate coordinator that are willing to spend your afternoon with us. Today is actually more of the training of trainer session. For your information, we have the guests from AMBOSS. So AMBOSS is actually an online learning platform that we have subscribed for this year. It's going to be our second year. But I think our license, our subscription is actually very limited. So we have purchased with AMBOSS for 200 licenses for students, and we are given another additional 100 for lecturers. So I have disseminated, I have shared with all the respective department, and I hope that you have gotten the codes from your head of department. If not, you can approach Puan Roslina or Puan Ikin to get your code, so that we, as we go along with this session, you can have access to your own particular account, and you can try yourself. And if you have any difficulties or any question regarding the platform, we have the expert here. So before we go to the TOT session, perhaps I can give an introduction of what we have been doing under pengajaran team and the teaching team. So we want to look for various ways on how to transform the way we teach. We are no longer going to the conventional lectures. We are trying to inculcate or to promote active learning through students. But we as a lecturer, we need to be, ahead of the from students. So we need to know what we want students to try. So as for now, students really love AMBOSS. They love it so much that when we have reached the deadline, for the last licensing last July, they straight away texted me, "Doctor, we couldn't get access to the AMBOSS, so I need to approach Nick in the UK to give us the license before we could actually proceed with the purchasing." So that's how much AMBOSS can help us to get the access for the student, especially for the final year student. They love it so much because they said that the question is really up to par to our professional exam. So they want to have like the kind of training. Okay, because we have our guest here, Dr. Fidan Senova. You are Turkish. Yeah, Turkish, but she is based in Melbourne. So so I would like to introduce our faculties. So our Faculty of Medicine is actually have 3 programs for the undergraduates, but we have many various varieties of postgraduate programs. So but I know that AMBOSS mainly utilized by the undergraduate students, and I hope that even though that the postgraduate coordinators are here, but you also teaching the undergraduate students, that I hope that you can get something from this session. So how our faculty can support you as a novice or experienced lecturer. That's why we are trying to have a series of TOT session. Not only with AMBOSS, we have yesterday, for those who attended our session, so we have another session yesterday with Elsevier to use about the clinical key platform. So we are actually welcome. So as many as platform that we can, so to like further utilize and support for the active learning. So do we need to transform our learning in medical education? Yes, because we have to be up to date. And of course, we have to be up to date as a Gen Z. Slowly but surely, but I think that this is actually the beginning on how to train you to be up to date with all the online learning platform that we have now. So we have a multi-pronged approaches to teaching preclinical years like students. So we have concept lectures, we have the mixed expert session, we have PBL, TBL, practical and SLP. So perhaps that you can think of ways on how to utilize AMBOSS platform to supplement your teaching learning methods in the preclinical years. So you have also during clinical years, we have year 3, year 4 and year 5. So we have various teaching learning techniques. They go to the clinics, they have the walk round, walk work, they have the common weekly common lecture, so they have tutorial seminar, they have bedside teaching and the simulation lab. So a little bit of the clinical postgraduate students. So they are much mature students. So they are the independent learning. So learning when they are working. So they also have lecture seminars. They have also case studies, research projects, simulation lab, and they also have weekly CME. So we need to know the diversity of our students, especially the Gen Z now. They are more on the not on the writing side, but they are more on the kinesthetic, and perhaps some of them are more to audio. And I think most of them they love watching videos, and they are now actually they appreciate something that on their iPad, your tablet. So with all the things that we can get on the online, so they appreciate it a lot. So we also need to cater on the Bloom taxonomy. When we talk about education, we talk about Bloom taxonomy. We are talking about the cognitive part, where the student needs to understand the theory and its application. The psychomotor part, where they have, they need to do things, and the affective part, mainly being catered by the PPA, when the student need to show feelings, attitudes, and emotion. So this is where the AMBOSS comes in. So how to leverage AMBOSS in your teaching. So AMBOSS is one of the online learning platform. It's a powerful learning platform and clinical tools combined into one platform. So in this platform, we have the question bank. So they love it a lot. But we also, I think in UKM, we allowed 50 questions per month, right? We go for the basic one first because we do not want to, dive and, suddenly like no one actually attempted the question. So we want to start slow. And then we also have the quick explanation. So where they, when they answer the question, they have the brief definition and they can liaise or link to the full article. And they also have a lot of images with overlays where they can practice making diagnosis with thousands of imaging examples. So this is actually the report I got from Mr. Christopher in last year. This is what the student has used our platform, the AMBOSS platform. We can see that the usage is actually peaked in October 2023. I think this is because we have that session with the student, so they're getting excited, and then during that time they have I think the preclinical years they have end of module exam, so they are really using the AMBOSS as a part from their supplementary learning. So when we further scrutinize which subject that the student actually read, they get the first page is cardiology. It can mean two things. One is maybe that they didn't get the teaching learning package from the lecturers, or perhaps that the cardiology and angiology is something that they want to venture on or learn more on during their learning. The top 20 subjects, when they go for the questions, they actually attempted more on the endocrinology, hematology, pharmacology, cardiology. So I think that from this trend, we can see that this is most being utilized by our preclinical students. So, without further ado, I would like to introduce our esteemed speakers, Dr. Fidan Senova, who is a partnership manager, Oceania and Asia at AMBOSS, to give the training of trainers session for today. Thank you. The mic is yours. Thank you very much.
Assalamu alaikum. Hello, everyone. I'm Dr. Fidan Sanova. Thank you so much for that introduction. I'm Turkish. As she said, I was trained in Turkey and I was trained in emergency medicine. That is my field, which I will use it as a base when we talk about clinical topics. But if at any point, if you would like to see something relevant to the field that you teach, I would be happy to help in that way. I manage the Asia-Pacific region, so I go all over the region to do these kinds of trainings, but this is a first where we have such a great group together, which is very valuable because it will help your students more when you can fully understand all the tools that they have available. First of all, let's talk about what AMBOSS is very briefly. AMBOSS is not just a reference tool. It's not for something where students, oh, let me check the dose of this medicine, let me check the pathophys of something. They can do this on our platform, but we offer a lot more than this. The problem, as you know, with medical school is there's so many things to cover for each and every one of your fields, including all things combined. There's thousands of textbooks, books, everything. And the current information is that medical knowledge doubles every 12 hours. So all these things, it's hard for the students to learn. Back in my day, we used to stack the books together when we graduated and like stand next to them to show, you know, I've read all of these things, I've figured it out. And this is what our founders were dealing with. They were medical students in Germany and they had this problem. And as students, they had the idea for AMBOSS. And they created this platform. So in the platform, we have an editorial team of over 250 physicians from all over the world who read all these textbooks and journals, guidelines, all this information, and make it easy to understand for the students. Because when they're learning something new, it can be hard for them to understand. After years of practice, when you look at an article, it's understandable for you, but the students struggle. And they need all these new ways of learning, as Dr. Akmal was saying, with videos, with audios, with all these little tools to help them learn better and learn faster. So this is what we're kind of trying to do. We are not saying that you find every bit of medical information here. We are saying that we will provide you with the best way to learn all the information that you need. Because there's tons of things, there's notes, lecture notes, presentations, there's books, notes you get from your seniors to how to study, all these things, question banks, flashcards. And the students, especially in undergraduate, when they're just starting out, they're panicking. They don't know. They have limited time and they don't know how to put everything together. So this is what we do for the students. On our platform, the students get to see their own weaknesses and strengths. For me, this was biochemistry. I was always very bad with biochemistry as a preclinical student. I couldn't figure out why I needed to learn it so in depth. I was like, oh, I want to be a clinician. I don't want to learn this. Then I got into emergency medicine training. And resuscitation is all about biochemistry and physiology. So I had to relearn it, because back in the day, I couldn't link the preclinical topics to what I will be doing in my clinical practice. Now I've been practicing for over 5 years, and biochemistry is such a close part of my life. What we do is we teach everything, we show everything with regards to how it will help them be a better physician. Whether it's in research, academics, or clinical practice, they will link everything together. So when they're learning, they understand how it is relevant to them. And the main thing is, so with biochemistry, for me, I was really bad. AMBOSS understands this. As I solve questions, as I read articles on the platform, AMBOSS will know that I'm bad at biochemistry, but I'm good at microbiology. And it will tell me, you should study biochemistry 2 hours, microbiology 1 hour. This is what you need personally. It's individualized teaching and individualized learning. Because every student learns differently, they have different needs and different goals. So I will show these now on the platform. I think it's better to spend time in the actual place. But our main thing is that we have a very big library of all this information, and it's in very different forms. So we have the videos, voice recordings, we have podcasts, we have tables, flowcharts, everything. We also have over 9,200 questions right now in our question bank. Some of these questions were in collaboration with the New England Journal of Medicine. Over 3,000 of these questions were acquired directly from them. We recently purchased one of their softwares. And the analysis, this is the thing that I believe you will value the most. This is what I want to showcase today, because this allows you to see the performance and understanding of each of your students individually, and it works as a built-in curriculum gap analysis. If you see that 60% of your students are struggling with a particular topic, maybe we should look into that class. Maybe there is something that they're not understanding, and you can understand the weaknesses of your students and teach them in that way. This is one of the add-ons that we have. Anki is a flashcard platform. It is very popular among the students now, and we offer them the AMBOSS information on their flashcards directly, so they don't have to worry about it. Now, I'll go to the platform to showcase certain aspects here directly. When you set up your platform, you have the option to choose your school, what year you're in, or if you're a physician, which field you practice in, and what your goal is. This is very important because the goal that you choose affects what AMBOSS shows you. If I am a year 1 student studying histology, I have different needs from an article compared to a year 5 student who is doing infectious diseases rotation. So you get to choose it here based on clinical sciences or basic sciences or combined. I will start with basic sciences and then move to clinical sciences. And let's say I'm choosing histology as an example. Now that I have chosen this, the AMBOSS articles will offer me different highlights and different points and give me different advice. You should read this article before that one. If I had chosen microbiology, it would give me different advice. Let's go to an article. So as a lecturer, if you have a class, say, on pneumonia or lung tissue histology, respiratory histology, you can go into our articles beforehand. We structure everything, as you can see, from beginning to end of how to understand this topic. It starts with the etiology, classification, with pathophysiology, which has all these details. And we don't offer everything openly at once, because students, they look at a page, they see a lot of writing, they look at a book, see all the writing, and then they get overwhelmed and they stop reading. So we want them to be able to choose where to look at. So let's go pathophysiology. Everything we have is bullet points, numbered lists, tables, so things that are easier for them to understand. And let's say they don't know any of the words here. So they don't know what exudate is. They forgot for some reason. They can click on it, and immediately they get a little pop-up explaining to them what that means. So they don't have to go to a different page. They don't have to get distracted and waste their time going from page to page. They have everything in one place. So now they know what exudate means. Okay, they go down. And then there's the tables. Again, all of our tables are also interactive for them to use. They can have quizzes on them. So what is the microscopic findings of congestion for lobar pneumonia? They try to guess it themselves, and then they click to see if they got it right or wrong. So it's kind of like a flashcard also for them to be able to test themselves and their knowledge as they're learning. As we move ahead, because this is pathophysiology, we have interactive microscopes. So this actually looks great. I don't know if it will look as good on this, we'll see. But this is an interactive microscope where you can zoom into the cellular level. Different areas are marked on it. I'm just going to try to zoom in and see how much it loads here. And you can scroll this entire tissue for different parts of it, and you have the information right here. So that's a macrophage, that's a neutrophilic granulocyte. You can zoom out, you can scroll over, there's other areas that are marked, and we offer this for every tissue. I'm using pneumonia as an example right now. This is a lobar pneumonia sample, but you can go into, for example, the bronchopneumonia sample as well, and you can have the same thing on this tissue. And again, we have this on different topics and different needs. This allows the students to have the experience of a lab in their homes, on their phones, on their tablets, on the computer, so that they can understand better. We used to draw these. In my time, we had colored pencils to draw what we saw in the microscope so we could study at home. So it changed quite a lot since then. And again, you can zoom into a cellular level, which really helps them in their learning. This is just one of the tools that we have with regards to preclinical kind of studies. And you can see that I have this little highlight here. The students are able to highlight anything that they find important so that they can refer to it later. But additionally, they can also see the highlights that are relevant. I'll move this to the student mode, that are relevant for their goal. So when you're in the article, you have the option to choose this here, this thing here, key exam info. This is with regards to their own goal. So right now we have histology. So this will highlight parts of this article that are relevant to my goal, which is I'm studying for histology, preclinical sciences. So it will not include clinical information that may not be useful for the students. So it's just one of the things that we offer here. And let's say the student is studying, they've gone through these topics, they're learning. They want to take a note. Assistant Professor Akmal's class, she said that this is important. This is important for class of Dr. Akmal. So I can take this note here and I can save this. And when I'm studying, I know, oh, this is something the professor mentioned in the class. And I also can share this note with all of my classmates. Or, as lecturers, you can write notes into sections of each of these articles and share it with all of your students. So they will see, oh, professor mentioned this in class. Professor thinks this is important for me to learn. This is especially useful considering not everything is the same internationally. There are Malaysian guidelines, Malaysian approaches to things, especially when it comes to infectious diseases, public health, epidemiology. You can make your own notes for the students to see. So here, this note is from another AMBOSS employee, Maria Jose's note. She wrote something here for revision for pathology. That's Spanish, she lives in Latin America. So I see it here. So they will see it in this way. They will see, oh, Professor X's notes here on this topic, which will help them to learn better and to understand where they should be paying their attention. Now, in the same article, in a more clinical sense, we always include the relevant physical examinations with video and with audio recordings. So here, that is a full examination of the respiratory system, including auscultation, palpation, percussion, everything. And when there are relevant sounds, so if we go down in this article to specific kinds of pneumonia, or we go to something like pericarditis, etc., where there is a specific diagnostic sound, we have recordings of it on the platform. So students can listen and see, okay, so this is what it's supposed to sound like, this is what I'm supposed to be doing. When it comes to diagnostics, we offer them, we tell them, you know, this is what tests you do, this is what image you ask for, this is what you order, and we also explain to them why we are doing this. So arterial blood gas, you see decreased partial oxygen saturation, and you click, and you see that this is indicated in patients for this condition. So it helps you in understanding why you're ordering certain things. When it comes to imaging, this is one of my favorite things. So when you first look at an X-ray for the first time, before you actually know medicine, you look at this and it looks like a blob. You barely understand what you're looking at. So to help with this, we have created a function which is called an overlay function. When you click it, it shows you what in this image you're trying to focus on. And it explains to you on the right what that actually is. So in different images, you can see that different sections are highlighted. The lower lobe, the trachea is over there. All these things, just so the students can understand what they're actually seeing. We have this also for CTs, MRIs, echocardiography, ultrasonography. The CTs are interactive and 3D. So I'll show it here. The students can actually scroll the same way that they would in the hospital systems and see it in a 3D way. What the problem is. So we offer all these little tools that we normally have in the hospital, and they can scroll and actually understand on a 3D perspective what things look like. And they can turn this off if they like, so they can actually see what the tissue is, but they can also see and understand what they're looking at, with explanations, with an understanding, just so they can have a better learning experience with regards to this. And as I said, we have this for echocardiography, ultrasonography in the relevant articles. I'm just going off this one for now. So when we go to advanced diagnostics and treatment, we have different setups for preclinical students and clinical students, where a preclinical student might only need to know the class of medications that you're giving, and they don't necessarily need to know the exact dosage, exact timing, etc. Clinical students do. So we have a separation for this. They can click this button up top that says clinician, which will allow them to see extra information that the clinician needs to know, either clinical students or junior doctors, but the students don't. So this section just appeared as soon as I clicked clinician, because this is a step-by-step guide on how to approach a patient to make sure that you're not missing anything. You can know immediately what you're supposed to be doing, step by step, especially again for juniors and clinical students, so that they're not missing anything and they don't have anxiety. In cases where you use calculators for risk stratification, disease management, treatment planning, etc., we have them inbuilt on the platform. So CURB65 for pneumonia, you click it and it immediately just asks you questions. You don't have to memorize it, though you can, but it just asks you, is the patient confused? What's the urea level? What's the respiratory rate, BP, age, and it gives you a result and tells you, so the CURB score is 1, possibly inpatient, and just explains to you what this means so that you can move ahead knowing the CURB score of the patient without having to, again, go to a different page. What we want is to have everything in one place. Everything that I'm showing right now is also available on the mobile app. So this is what the students can actually access as they are working and studying. Everything, it's not very, I guess it is. So the blue things here, they're all related to clinical practice and the clinician mode, where preclinical students may not need to know it, but we do offer them the ability to see it. When it comes to medication treatment, here you can see that we also include dosage, and we also link to the drug page. We work with a pharmaceutical association, and they provide us all this information. You can just click and go to amoxicillin, and it will give you everything from dosage, administration, contraindications, dose adjustments, anything to watch out for, special populations, all the warnings. This is basically the prospectus inside the drug box. We provide all of it here with the goal of helping the students access this information more quickly. Now, this is how the students can use AMBOSS and all the things that they can access. This so far has been the library, our library of information that is provided in different ways for the students to learn. This next part is about the tools that they can use to actually enhance their learning. When you go to the library section here on the left, we have 2 sections, articles and videos. Our videos include all different kinds of functions. One of them is 3D anatomy. This is an interactive 3D model of the human body where you can click and go to any parts of the body. You can add, I'll open one just as an example. You can just manipulate it, add or remove tissues. If it moves there. Yep, there it is. Very similar to our interactive microscope, we like to offer this as another alternative way of learning, which is interactive, where the students choose themselves how they're actually using these tools. Yep. So you can monitor it, you can move it any way you like, manipulate it, you can click on any particular tissue or bone in this case, anything that you'd like. You can zoom in throughout the model, and you can adjust here what you would like to see. So you can remove the teeth, for example, if it's in your way and you want to look at something else. The goal is, again, to give the students the opportunity to learn in an interactive way, which aids their retention. They remember it better. when they get to play around like this. So this is one thing that we have with our videos. Other things are the physical examinations. As I've mentioned, we teach everything step by step with video. So when you look at heart, the cardiovascular examination, which includes recordings of actual sounds. So they can listen, okay, so this is what I'm supposed to hear, this is what they mean when they say S2, S3, so they can actually understand it. And we give examples of specific pathologies as well. So aortic stenosis sounds like this, regurgitation sounds like that. So these can be quite hard for them to hear with the stethoscope, like they put the stethoscope in wrong, you know, when you first try it, it's common. But this is just a way to get them used to it. And as you can see, we have tons of different illnesses and pathologies that you have examples for. Arterial examination, venous, we can go down to, as you can see, all of these different topics have quite a lot of different videos, from deep dives into specific pathologies or just general what you should do as a base kind of thing. And we also have videos explaining, like as a lecture, basically, like a summary of a specific topic so that they can review the topic with these chalk talks here, which is just, it's most common in preclinical topics. We have these in physiology. We know that students can sometimes struggle with these biochemistry, physiology kind of topics. So just explaining everything one by one. These are all recorded lectures, basically, by our physicians. And they are quite base level, I would say. These are not enough to be a full lecture on their own. But a student who has taken this class, who is preparing for an examination, can watch this and make sure that they have everything in control. With regards to our articles, again, it is separated into all these different topics. Particularly, I want to show clinical skills. We have OSCE cases. We have 40 different OSCE cases that are interactive with a fully functional hospital record system. So you could do these with your students, or you could give these as assignments to your students, where in each of these cases, there is an guidance for the person who is the simulated patient, guidance for the person who is taking this OSCE, this exam, and the person who is the examinee who will take notes, basically. So you get information about the scenario and the tasks that you have for the examinee for this OSCE, and then you have the patient encounter where you have instructions for the patients. In general, when schools use these, they have one student be the simulated patient, another one be the physician in that case, and just kind of do the whole thing. There are some challenges that we add. So some difficult patient interactions, for example, where the patient is uncooperative or patient has specific cultural concerns that you have to watch out for, you have to be mindful of, to give these students a real life experience, because as we all know, real patients, they don't come like textbooks. So this is why we include these kinds of challenges. It includes everything from history to exam to interpersonal relationships. And at the end, this is what I meant here, we have this interactive patient file that the students, the examinee can fill as if it's like an actual hospital system. And they can print this also, which they like to do to keep as like a memory, but it's also good for them to see what they're actually getting, what they're missing, and then their lecturers or whoever is administering these sessions can review based on this and give them feedback. So they get to save all of this, submit it, and download it, just so this provides a more structure to this patient interaction. Now, after the students have studied anything, either basic sciences or clinical sciences, let's go to emergency again, what I know. Let's go with cardiovascular, since that was a very high interest topic. Let's go to chest pain. Very important topic. They will need to study, they will need to know this very well, and they will need to know the differentials very well also. When you look at this topic, let's say you've read it all, you've studied it. The article, this particular article has an approach for all patients, and then it has a section where it tells you how to differentiate between different systems. Is this cardiac? Is this trauma? Is this pulmonological? and it shows you again step by step with all the scores and criteria, etc. Now, let's say you're teaching this to your students, and then you want to quiz them on this. We have this button here, which is a QBank session. Students can go immediately here to get all the questions. Because I chose histology, it's showing me something else. Because there's nothing in this particular article about histology. I'll go to QBank here to do it a better job. So students can choose, and you also can choose whichever class that you are teaching. So let's say you're teaching, I'll go to microbiology. So you're teaching microbiology. And you want the students to have questions from a specific system. So you can choose, if you're teaching microbiology, you can choose related to the endocrine system or cardiovascular system or, I don't know, immune system, whichever it is. So this will limit the question bank to questions that are related to microbiology and also these particular systems. You can then choose the difficulty of these questions, 1 to 5. 5 are very intense, several layer of clinical thinking questions generally, but 1 to 4 is questions that they should be able to do, mostly. 5 is a little scary, that's why I'm just saying that. With status, you can choose, you know, if you've seen this question, if not. And then you can say questions with images or not, etc. So there's 71 questions within microbiology related to these systems that we chose. And we can choose to see, let's say, get 3 of them for now, as an example. And you bring up these questions. So you can use this section of choosing the systems and the disciplines and everything to get our questions, and then you can decide if you want to quiz your students with this or not. So this is a question that you get. If you like this question, you can actually save this question into a folder that you create. And you can create this folder saying year 1, semester 2, etc. So I can create one, year 1, semester 2, block 3, whichever it is, and I can create this folder, and now I can put as many questions as I like into this folder, and then I can quiz my students with this, with the questions that I choose. After you create this, so this is what the question looks like. You choose an answer. If it's incorrect, the question bank will give you another chance to answer it. This is the study mode. You can send your students these kinds of questions where they get extra information here and they get these underlines here, which will help them choose again, and maybe they can get the right answer this time. And when they do get the right answer, they also get information on performance. So 49% of people got this question correct on their first attempt, whereas the second most common was lamivudine, then ritonavir, etc. But it comes with the explanation. It's not just about you got it right, you got it wrong. It's a teaching and learning experience where they can see, oh, so this is why I got it wrong. And then, as they're reading this, they can click information here and see it on the same page. Again, our goal is never to get people distracted. Attention is very hard now, and the younger generations have more difficulty even having focus in the right place. So we want it immediately here so they can read. They're like, oh, okay, so that's the case, and move on to the next question. So this is one way of doing it. Another way of doing it is, I'll just finish these randomly. At the end of the sessions, the students get feedback. They get to see how much time they spent per question, what is their percentage of correct answers or correct with help, because they can get the underlines if they'd like. And then they also get these statistics, so the difficulty of the question, how much time, and the peer stat. So 82% of people got this question correctly. It should have been easy, but you got it wrong. So it guides the student in a way. As the lecturers, you get to have this information for all of your students. So if I were to send any of these links to, let me just get it here, to my students, this is kind of what I see as, so this is a test account that we have. This is the AMBOSS University, basically. You get to see the performance of each individual student. Let's say you sent that to your class. They will be all listed here. You can go here. This is cohort-based, so everyone in year 1, year 2, or you can go session overview, and the session would be the block that you just created. You can see everyone's performance, how many days they were active on the platform, how many questions they answered, their correct percentage, how many articles they read, how much time they're spending per question, to understand their performance. And then you can also click on an individual student to see what their study recommendations are. This takes a second to load. While it loads, I'll show it here. The study summary page is what each student sees based on the goal that they choose. So because I chose histology and I haven't really solved many questions, this is my current performance. I'm not actually this bad, this is just a demonstration. And then it tells me what I should be reading next. If my goal is to pass an exam of histology, based on my performance, this is what I'm going to get the most value out of. If I have 30 minutes to study, the number one thing is what I should study to get the most benefit. Then number 2, 3, etc. And these lines here indicate my performance with the questions that I've solved. Is this loading still? Yep. So when you choose an individual question, you get to see their performance over time throughout the time that they've had the account. It gives you their overall results. So this person is getting 71% incorrect. Their initial answer profile, so when they first attempted a question, it was 66. And then their latest one, so their most recent attempt at these questions, is 67%. And how much they've done of the Q bank, they haven't answered all these thousands of questions, so there's a lot more for them to do. And this is the recommendation. So this person is weakest in the musculoskeletal system. This is what they should be studying in terms of systems. You can also go into clinical subjects. So based on whatever it is that you choose, it will show you the performance and what they should be doing. And you can also go to articles, specific articles that they should be reading to reach their goals. This is what you can achieve by going in and choosing the questions for your students and sending it to them so that you can just evaluate their performance. In this way, you know how much time they're spending, what they're weak in, what they're strong in. And if everyone is struggling on the same thing, maybe have a little extra chat about it, try to figure out why they're struggling in this way. You can also look at our custom study plans. We have them for every discipline. So let's say you're doing, I'm not going to do emergency medicine this time, neurology. You go in, it will tell you which articles you should read, the questions you should solve to cover these topics accordingly. We have this for everything, so I just chose this one randomly. But we have all of these for both preclinical and clinical fields so that you can actually prepare and study. We also have them for international examinations such as USMLE, but that's entirely up to the students. And the students can also create their own study plans based on their own performance. So if you have an exam upcoming, September 15th, you can choose the topic of the exam, what you're studying for, let's say biochemistry. And I want to finish studying on September 14th, 2024. And I only want to see the questions I haven't seen yet or the ones I answered incorrectly. So I don't want to do the things that I already got correct. It will now tell me that I need to study 2 days a week for 2.5 hours per day. I can adjust this as I like. So let's say I want to do the weekends actually. So it's 4 days per week now, and I get to decrease this time. If I decrease it too much, it will tell me that it's not enough to complete all of the content because it divides it per day. So if I say 1.5 hours, this will end by September 8th. It will give me questions to solve every day and an analysis of how I'm performing with each of them. I can click here, which will take me to 27 biochem questions for the day, and I get to solve those. And as I keep going throughout the week, I get weekly updates and daily updates on my performance. As you solve these questions here, you get the feedback immediately under it. And you also, on this right, these lines start to fill up with the questions that you solve. We're trying to be very kind of understanding of the needs of each individual student. I don't like to watch videos because I like to listen to music when I'm studying. So what helps me is the tables and the flowcharts, which I find quite useful when I'm studying. I'll go back to, let's go to pericarditis. So if I'm studying and I'm reviewing something, I don't want to watch the videos because I don't like them, but I can use this button here, which is called high yield. I'll open all of this up first. When the students click that button, it makes the article shorter. It takes out the, I guess, more detailed things that you may not need, or the things that are not the base core of this topic. So now this entire thing is shorter, and this allows me to study more efficiently and spend less time on it. If I'm reading it for the first time, yes, I will have this off and I'll read all these extra things. But if I'm reviewing it, I'll turn it on and only read the most important, the most valuable things in this topic. To save time. So this is what I would do because that's how I learn, but some other person will want to watch a video explaining this topic and have it on 1.5 times speed so they can just speed through it, but I can't do that. So we want to give the tools for everyone. This is the recording that I mentioned. We have these kinds of recordings everywhere. And in this article also we have some echocardiography videos. Just to kind of teach the students. Same with ECGs, actually, I can show this. When we have tests such as the ECGs or pulmonary function tests, we have the same overlays here as well to explain to students how to evaluate these things. Again, we have this for everything. The ECG is just an example, but the goal is to have them understand what they're actually looking at when the differences can be millimetric, especially for things like the ECG. We have tons of these with the explanations on the right so they can learn from themselves. And again, with the images, with the videos. So we have the point of care ultrasound video. We actually also have classes teaching these. It's not available yet. It's available in the German version. We're bringing it to the English soon as well. But we have videos teaching students how to do point of care ultrasound, how to learn all these practical clinical skills that they can use in their clinical lives. This is pretty much it as a base of what you can do with AMBOSS and how you can use it to teach. Please, if you have any questions or if you would like to see any particular article, for example, like how does this look there, how is that there, I would love to show it and answer any questions you might have. Thank you so much for your time.
You can open the floor to any question. I know it's a bit hard for a beginner, but do you have any questions as we go along with the platform?
I don't know what you want to do.
Maybe I can start first.
Because in medical curriculum, in our medical MD UKM curriculum, we use a lot of active learning method. So let's say, how can we use AMBOSS as a part of our teaching learning method? I know that we can ask students to go to AMBOSS and then read about this. But how can we integrate that into our teaching, like in face-to-face teaching?
Thank you so much for that question. We have all of our questions are clinical vignettes. So when you look at our questions, it's always 62-year-old patients coming in with this complaint, with that complaint. And we also have the OSCE cases that I've mentioned. So because we have thousands of questions and all these cases, you can analyze them with your students. I do this for emergency medicine, where I go through our questions as if it's a real case in front of us. So if you can open this again, I will show how I do it. This is how I teach. I'm not a very experienced lecturer, but I used to teach interns and my juniors. But this is one of the ways that we use it in active learning. I think it's so what I do is basically divide our questions, like the Q bank that I just saw, if I want to teach a particular topic, so what I used to teach was 3 workshops on chest pain with its differentials, abdominal pain with its differentials, and headache with its differentials to interns and first-year residents who needed to be able to accurately differential, so to keep everyone safe. So in order to do that, I go into the Q bank, I choose chest pain, and I choose systems to choose some questions, and I put them into this, if they bring it, I put them into a presentation. Is it okay? So I work through it as if it's a real case in front of us. What I do is there we go. So I use our question bank and the OSCE cases to create study cases like this, where it's interactive and I ask them. So I present a history of a patient. 35-year-old man comes with this complaints, this is what happens, this is the history they are giving about their complaints. And then I highlight certain things. I ask them first, like, what is it here that you believe is important to us? What should we focus on when we're taking the next step? What are we asking this patient? So then I highlight the things that I believe are important. So this is things that we have to keep in mind. Then I provide more information. He was on sick leave, he had these extra things, this is his social history, smoking, drinking, etc., and what we should do next. So his sick leave last week, this is relevant, we should keep this in mind. We move on to the next thing, his physical examination. And at each of these steps, before revealing what I think is important, I just go with them and ask them and what they think, and they also try to give information. And when I do this, I usually do this in the context of in-services, like in the clinical teaching. So they can also actually use the resources. I encourage it. If you can find the correct information in the time between, you're speaking to the patient, which is, you have like 30 seconds, go for it. Step by step, I give more information. I ask questions, I give examples like this, and again with the overlay. So I give with, without, to see if they understand, and then we discuss diagnosis and treatment step by step. So it's kind of like case discussions. And almost every single one of our questions are suitable for this. But we also sometimes ask the students to create these themselves, to go through the questions, and we try to keep our questions interesting. So we refer to popular television shows, Breaking Bad, Friends, The Simpsons, whatever it is that they might recognize from their lives, because to get Gen Z, younger people interested, it's good to have these connections to things that they like. If we make a joke about the Olympics, and I come from Australia now, so, the Australia breakdancer did all these ridiculous things and everyone's making fun of it. We put those kinds of things into the questions, If we put a question like that and talk about the psychological state of grandiose delusions for this breakdancer, the students will like it. And that's what we have in our questions. Make it relatable, so it's not just a random case discussion. Sometimes there is a question about House MD, so they recognize it. Oh, that's from House, and they become more interested. So we believe that in this way, it can be used in class by the lecturer managing the conversation and have the students be more involved.
Maybe we missed a little bit on how you get to the case number 1.
Oh, yes, of course. So when you first log into AMBOSS, the first thing you see is the dashboard page. The dashboard page, I'll move, so it will show you the study plans. For the students, this is what they see for the study plans, and the performance of their goal, etc., etc. To go to the clinical cases that we just have, on the left we have this button here. You go to the button with the 3 lines, and then you go to the library and our articles. In the articles, we have clinical skills. I can send this as like a GIF, as like a little document, if that will make it easier, like step by step. You can go to clinical skills, which have all of our clinical cases. And here you can choose whichever one you think is relevant to your teaching, and it gives everything step by step, how to evaluate this, use this as an OSCE, and go through everything with the patient. But again, what I was just showing, that is through the question bank. So if you want to talk about urinary incontinence as your main topic, regardless of the etiology, you can just get cases regarding urinary incontinence and go through the differentials with the students. Or you can choose a pathology and go just with that. To do this, on the left, we have this button that says QBank. When you press the QBank, it will give you options. The QBank overview is the best way for you to get questions in a field that you like. Is there anyone who wants to see a question in their field? Any particular? No? That's okay. Okay, I'll do something. I'll make this a clinical field now. I'll close this, open this. Let's go with obstetrics and gynecology. And then we can, again, choose systems if we like. If we want cardiac pathologies during pregnancy, for example, we can do this. Or we can just choose symptoms and go with urinary tract, genital region. You can choose specific as well, like you don't have to go with all of them. You can choose specific pathologies. I'll include these symptoms. And then we see that we have 183 questions here. Let's get 3. And this is up to you. So if you want to choose all of them, you can. You can choose questions with images only. And this time I will open it in exam mode. This is how you can send it to your students. In exam mode, they don't have the supportive tools that I just show. They will see it as an actual exam where they have one choice. So they choose and they get the feedback after they finish everything. So it looks quite different to the other one because this is about an actual way of examination. We have universities that use these as part of their examinations for the students, for quizzes, for blocks. They still get the lab value references and calculators, but other than this, when they read the question, they have just the option to choose and proceed to the next item. They don't get feedback, they don't know if they got it right or wrong. They can still highlight things if it helps them to study, but they do not get to learn if they're correct, so it's an exam. Again, our images are high resolution. They can choose whatever they think is the answer. And they get a warning, hey, if you finish this now, you cannot change your answers. Until they submit, they can go back and change their answers. But after they submit it, it's done. So if there were 3 questions, I got 1 correct, 2 incorrect. And now I get to see my answers. Now that I've finished everything and I've submitted it, it goes to the faculty. So you will be able to see this student did 33%, but they can go back and actually review these in study mode. So they get the explanations immediately. They don't have to worry about which one did I get wrong, why did I get it wrong. They get the feedback immediately with the questions by seeing it in study mode now. So now they get the feedback. And you can find any combination of any topic. I'm just going through random ones because there's no particular request. On the top left here, above the QBank, is the educator tools. This is what you all have access to. And here, you can see the university sessions management. And this is how, as I showed before, you can save the questions into folders. And here, you can publish them. So this is the one I created earlier in the session. That's what you can do, put everything into a folder, and then you can publish it, and your students will be able to access it either through their platform directly or by a link, up to you. And this button here, Data and Analytics, takes us to this page where you can see the performance of all of your students. I do not think that this is live yet for UKM. This is something extra that we offer, but we are very happy to offer this because it helps it when students can understand their own performance and for you to understand the students' performance. As we were saying, the license is quite small right now at UKM, but if we expand it to have your students and the full cohorts, etc., this is something we would like to offer for free. Just so you can get that kind of feedback as well. Are there any questions? Thank you. Thank you so much. They don't? We can... If it's not there, we can do it as an extra.
Can someone please confirm, whoever that have access to the AMBOSS right now, can you see the educator tools on your left side? No.
Yeah, so the
You can choose both. If you click on student, you can go to clinician. That's up to you. But the educator tools on the left here, on the left side of the page, it's not there. We can make the arrangements for this. If you would like to have access to this kind of data about your students' performance, we can make this arrangement. This is, as I said, something extra normally, but we would be happy to include it in our offer for next year as well. Yeah. So the way it works right now, the license here is that there is 20 accounts for year 1, 20 accounts for year 2, 30 accounts for... It's very kind of mixed. It's not a full... not every student has it here right now. Normally, we sell it per year. So everyone in year 1, everyone in year 2. This is up to the faculty to decide how they would like to have it. The way we link it is when the students sign up, they sign up through a specific process that we have, and they all become linked to this license that we have with you. So every student here who is on AMBOSS through this license that we have with you, they are all a part of this version, basically. So they will all be under the UKM. So instead of AMBOSS, it will say UKM, and they will all be under there. Ideally, generally, we go per year. So schools sometimes buy us for everyone. Every year, they all get it. Or they buy it for a couple of years first to try it out, see if the students like it, and expand it. We have both versions, yeah.
To answer your question, the student for UKM is based on 200 students, and each of them call it the code, access code, they are registered, and the codes are with the library. And then there is a free of charge, 100 codes for lecturers. So lecturers will also have codes and have their personal account. They get registered. And in your personal account, you should have on the left side of the interface, you will have this educator tools tab, and also you should just click it down and see that university sessions management, where you could choose questions, put it in your folder, and you can copy the link and send it to the students, and let the students do a self-assessment, and then you do an analysis of the student. So I don't think you have that in that package. So I'll go back and speak to our management to try to put that for you all, and then have access under the tab called Data and Analytics, where you can go to a separate interface where you can see the entire your cohort of students that we have sent the questions to, how many questions have they taken, if you have sent to so and so, 50 questions, but you saw that over the last 2 weeks we only attended 3, so you know that where they're going. You attended most of the questions, how are they doing? Did they get it right the first attempt, on the third attempt, on the second attempt to answer the question? And based on that analysis, where are they weak and all that, sums up the area what we call helping you to identify struggling students. So I'll check on that and give the management is only for the 100 lecturers that registered. So not all are registered, I think. So you can just contact the library, and they will be able to give you codes.
Yes, and that is one of the, I guess, cases that we make, that it's best to have everyone in a cohort. So if there's 100 students in 1 year, if you have each one of them has their individual account, when you look here, you will see each one of them individually. And that gives you a lot more insight to understand what exactly it is these students are doing. Because it can be because that particular student is lazy, maybe they're not studying, maybe they're not doing their work, but it could be something else, and this will give you kind of that understanding, you know, what are people reading? This is what Dr. Akmal was showing earlier, which topics are they reading the most, which questions are they solving the most, and this kind of background, and it makes more sense when the whole year uses it, so you get an accurate kind of feedback. Yes. You can choose. So we have here at the top, you can see based on cohort. You can choose here at the top, graduation year, and you can choose to see year 1 or year 2 or year 3 based on their graduation. So we actually have the capacity to separate that. So you can see all of them. So if you're head of education and you want to see every student, you can. But if you only want to see year 2, you can choose here whenever it is the graduation year for year 2 and separate it in this way, because you can see here also the graduation year of the students are marked. So we can separate in this way. You can also see based on sessions. So when you go to the sessions, this is what I just created. So 2024, year 2, block 3. If I create that, it's taking a little to load, but I can see based on that particular session also. So for example, this vascular surgery, somebody created this, 13 questions, 9 students started, students solved 11 of the questions on average, and this is the correct percentage, final correct, initial correct, based on their performance. So you can look at it on any level that you would like, basically. You can see per year, per session, or the whole cohort.
I think I would like to echo what Dr. Aida's intention, because perhaps Dr. Aida wants to curate one personalized package for radiology, because she's from radiology.
Mm-hmm.
So she wants the year 3 who's taking the radiology answer the question or
Yes.
take all the set of the learning packages in that particular radiology site. How do we determine that only year 3 can use that?
Yes.
Packages.
So the way to do this is, let's say this block was made for radiology. So you create your own block, you choose the questions. When you go to edit, you can choose the subject. So radiology, let me see. Scrolling so much. Radiology. You can choose the semester, so which semester the students are in. You can choose the organ system, whatever it is that you're doing at that time. So you can add these marks here. And then you can choose to have this by a URL or on the students' pages. So you can choose, let's say the students are enrolled in semester 4. So I don't know the system here exactly, but we can adjust this based on your needs. If you choose to put it on My University, they will have a little section here. The students have a different look, and they will see it. Oh, professor assigned me this thing to do. And only the students in this particular semester will see it. If you want to give it to particular students in that semester, so let's say there's 50 students, but you only want to give it to 5 of them, you can click this one, so not on My University, only by a URL. Then you will have a link. So let's publish this, save changes. Now you have a link here. And this link is the only way for the students to access this set of questions. So if you want to send it to everyone in year 2, you can do it. If you want to send it to a particular group in year 2, you can have this link and only give it to them.
So the
Yes. So
When they register to have access to the code, they have to put in a profile. It's like a Facebook profile. So they put in the graduation year, the graduation 2027, the year, what student, what all the
they have to choose their expected graduation year and their goal, whatever it is they are studying for right now. So this information is all there for us. So when you choose year 2, it's chosen based on their expected graduation year, and they can all access it in that way.
But for those who got gotten the link, whether that she or he actually from different year, they can also access that particular learning packages, right?
Yes, if you share the link, everyone with the link can access it, but you will be able to see their emails. So if you, I mean, the students might try to cheat, of course, but if I send it to 5 students, but one of them sends it to someone else to do it, we can actually see where people are logging in from. we have like functions like this too, but this is. It links the results to an account. So you see the name of the student, email of the students, graduation year, semester, etc., and they get it accordingly. Any other questions? Or I can show, as I said, a particular thing if you would like to see.
Can we create essay questions?
No, unfortunately, we only have multiple choice questions and OSCEs. What we can do is we can upload PDFs onto our platform. So for example, if you have a document that is a PDF, for example, the standard operating procedures of your hospital, particularly when it comes to family medicine, radiology, whichever it is, we can put it on the platform so that the students can see this is what I need to know for Malaysia, this is what I need to know for my class, and download it. But it's not really an examination thing, it's just extra information that we can provide to the students based on what you want them to know. But no essay questions, unfortunately, just multiple choice and OSCE. Any other questions? No. Unless you choose to publish it, the students will never see it. If you publish and say only link, the students will still not see it until you give them the link. So it's all private, they won't be able to access early. Yeah. Good.
Other than questions, any complaints about that?
Or any comments?
Yeah. Yeah. No, it's definitely for medical students, both preclinical and clinical, and I would say also for junior doctors, so interns, maybe first-year residents, when you still don't have the general clinical sense. But after you're more advanced in your training, there is not as much value. For fields that are generalists, like internal medicine, emergency medicine, general practice, family medicine, we offer a lot. Because, for example, I had a big hotel fire the first month that I was in the emergency. I had to treat a lot of burns, a lot of carbon monoxide poisoning, things like this. And then I didn't see it for 2 years. So you forget. So generalist fields can make use of AMBOSS many years into practice. But for more specialized fields like anesthesiology, radiology, it's good for the first year of specialty training. Or when they're interns or doing medical officer, hospital officer kind of work. Thank you. Thank you everyone for your time.
I think, I'm not sure that most of you actually has no question. And I get this question most of the time over Southeast Asia and I presentations. The question on the facade would be, what is AMBOSS? If I look into the question, what they are asking me is, what really is AMBOSS? I will tell them, AMBOSS is relationship. You can subscribe to any tools, physically you get journals, and all this, yeah, that's physical. The intellect part of the answer is relationship. Why do I say that? How many times or how many occasions in our experience of life have we come across these two scenarios? With us or even with other people. First scenario, I hate this guy. It's all about himself all the time. It's all about him. Tomorrow is about him. Yesterday and the next year is all about him. He doesn't understand. He doesn't want to understand. He doesn't anticipate what's my next steps. Bosan hidup dengan orang ini. Scenario 2, he competes. He's the air that I breathe. He understands me. He continues to understand me. He anticipates every move I want to make. I can't imagine a relationship without him in my life. And that's AMBOSS. Because AMBOSS was not created by IT wizards who woke up a coffee and say, hey, you know, you got to create a new software now and then get Chris and Finan, go out there and sell it to the market, tell the market, you don't adopt this, you're a morons. Was not created that. AMBOSS was created by medical doctors. Like you all, they were medical students. So now, even though they are professional doctors, but founders and owners of AMBOSS, they have a perpetual relationship with students worldwide. And that perpetual relationship is so intimate because they were students, they understood their difficulties, current difficulties, they understood what we actually really need in this journey of medicine study, and they understood how the relationship between the lecturers and the students could have been better. Yeah, you have a relationship with a student legally, financially, whatsoever, but what about real relationship? So AMBOSS was created based on that just cause. And that is relationship for the students. It's not created by some IT people over coffee and say, I want to create a new impactful technology and get the team involved and get people to adopt it. No. Thank you very much, gentlemen. Ladies.
Please welcome and join us to extend a round of welcome give a clap to our esteemed speaker, Dr. Fidan, Mr. Christopher from AMBOSS for willing to have this TOT session with us. So if you have any question, you can go through me, then I can forward your question to Mr. Christopher or Dr. Fidan. Please, my hope is actually that you can use this as a part from your teaching learning method to inculcate the active learning. We do actually, after this, the session with the student. So actually, students do really appreciate this particular platform, and we do need your support to have like this learning curve or learning cycle or the learning loop. Actually, we close the learning loop with the teaching learning packages here, and then the feedback from the lecturers. So we have tea outside. Please help yourself with the tea, and thank you very much for today's session. Without further ado, okay, I'll end this session with Assalamualaikum warahmatullahi wabarakatuh.
I always want to ask things. Of course. I just want to mention something awesome. Yeah. I mean, I didn't have access